Hi everyone, today we will discuss a most important topic in psychiatric, electroconvulsive therapy, short form we also known as ECT. It's a most important topic for any nursing exam review. What is the definition of ECT? It is a psychiatric treatment in which electrical currents are passed through the brain to induce a brief seizure to treat certain mental illness. What is ECT? ECT is a psychiatric treatment in which electrical currents are passed through the brain to brief the seizure or treatment of certain mental illness. Indication for ECT. What are the indications for the ECT? Severe depression, especially with suicidal ideation, and mania and schizophrenia, especially catatonic or treatment resistance. Catatonic means a patient is still sitting a position for a long time. Bipolar disorder, postpartum psychosis, neuroleptic malignant syndrome. Rarely it can be happen. Contraindication for ECT. Absolutely contraindication for raised intracranial pressure. Normal ICP is 2 to 8 mm of Hg. When the ICP is increased, it is totally contraindicated for the ECT. A relative contraindication is recent myocardial infarction, cerebrovascular accident, severe hypertension, and aneurysm, retinal detachment. What are the pre-ECT nursing care? Pre-ECT nursing care is NPO, nothing per oral for 6 to 8 hours before the ECT. We have to sign the informed consents. The junior doctor will explain the procedure to the patients, and we have to witness, as a nurse, we have to witness of the informed consents. Remove the jewelry, denatures, contact lenses, and void before the procedures. Vital signs, baselines, IV line insertions, and administer pre-medications like atropine. Atropine, why we are using the atropine? To reduce the secretion and prevent the bradycardia. Short acting anesthetic, example thiophantal sodium, muscle relaxations, and succinylcholine. During ACD, what are the work we have to do? Patient under the general anesthesia. When giving the ACD, patient always in the general anesthesia. Then bite block used to prevent the tongue injury. Then monitoring the EEG and ECG. EEG means electroencephalography and ECG means electrocardiogram. Electrode pads either bilateral or unilateral. Duration of seizure 15 to 17 seconds. Post ECT nursing care. Monitor the vital signs. Patient in the sideline position until fully awake. Monitor for confusion, headache, memory loss. Allow rest and reorientation. Ensure the airway patency. Observe for any side effects. Common side effects is temporary memory loss. When giving the ECT, after some times, it will show the side effect of memory loss. Sudden memory loss, temporary memory loss. After that, after few minutes or after an hour, he or she will get their memory back. Confusions like they will ask where I am, what I am doing here, or anything. They will ask headache, nausea, and the muscle soreness. Number of sessions. Typically, we are giving 6 to 12 sessions for patients, or if the patient is more severe, then we are giving the patient ECT 2 to 3 times per week. There are the two types of the ECT, bilateral ECT and unilateral ECT. What is meant by the bilateral ECT? When electrodes were giving the both sided of the heads, it's known as the bilateral ECT. It is more effective, but it can be more memory loss. Unilateral ECT, bilaterals, we are giving the drawing there. This is the head. Okay, we are giving both sides of the heads in bilateral ECT. Unilateral ECT, electrodes on non-dominant hemisphere, less side effect. Unilateral ECT, like this is the person heads. This person is a right dominant hand. Okay, then we are giving the person in the left sided, like left sided hemisphere, we are giving the electrodes. Then modified ECT, these are the most important or most usually used for the ECT. Then modified ECT, ECT with anesthesia and muscle relaxant, safest and most common used. Unmodified ECT without anesthesia, not recommended today due to risks. Before they are using the unmodified ECT without anesthesia. Then mechanism of action, exact mechanism is unknown, believed to increase the neurotransmitters like the serotonin, dopamine, norepinephrine. Legal and ethical considerations, informed consent must be obtained. Informed consent must be obtained from the family if the patient lacks insight, not used as a punishment. Strictly monitored procedure. And important MCQ facts for the nursing exam. Drug given before ECT is atropine. Purpose of atropine, reduce the secretion, prevent bradycardia. Common adverse effect is memory loss. Short-term memory loss, not the long-term memory. It is the short-term memory loss. Anesthetic use, thiopenton sodium. Muscle relaxant use is succinylcholine. Seizure duration needs 15 to 70 seconds. Position after ECT is sideline position. Contraindication in ECT is rest ICP. When the ICP is increased, it is contraindication. Thank you everyone. Please like, share and subscribe to know more video and more knowledge.